Good morning, everyone. My name is Alberta Noonan, and I'm from the New England QIN-QIO, and I will be your moderator for today's webinar, The Role of Community Health Workers in Chronic Disease Management and Behavioral Health. The Quality Innovation Network Quality Improvement Organization works with healthcare providers and stakeholders and communities across New England on data-driven quality initiatives to improve patient safety, engage patients and families, and improve clinical care at the community level. Thank you for joining us for today's webinar. Before we get started, just a few housekeeping items. This call will be recorded for training purposes. I'll provide you with details on accessing the recording at the end of this webinar. The phone lines will be on mute for the duration of the presentation. We will take questions at the end of the presentation. I will provide you with instructions on how you can ask a question over the phone or pose a question in the chat box. Please make sure to send all questions to all attendees. At this time, I'm turning this over to Michelle Kelby-Albert to get things started.
Hi, good morning, everyone. This is Michelle Kelby-Albert from the New England QIN-QIO. I'm really happy to introduce our three speakers today. I'm very excited for this webinar on community health workers and the role of community health workers, both in chronic disease and behavioral health. I think you're going to find this very informative, and we have some great speakers. Our first speaker is Amber Culver. Amber works at the North County Health Consortium in Littleton, New Hampshire, and her position is as a community health worker. As part of her work as a community health worker in addressing social determinants of health, overcoming barriers to chronic health conditions, Amber is also a trained peer leader in the Stanford Diabetes Self-Management Program, and also she is a coach for the matter of balance. So Amber has a lot of experience in her work as a community health worker, so we welcome her today. Our other two speakers are James Prue and Chad Plashel. Both James and Chad are from Ammonoosuc Community Health Center, also in New Hampshire. James is currently working as a community health worker. He has a background in law enforcement and is currently pursuing a master's degree in mental health. And Chad is a health education specialist has been at Ammonoosuc for about 4 years. He has worked in FQHCs. He has a background in nutritional services and, again, comes to us with a lot of experience in working in the community and working with community health workers as part of the community health services. So we welcome our speakers today and hope you'll enjoy the presentation.
We'll now pass it over to Amber to get us started.
Okay. Hi, everyone. This is Amber. Thanks you all for joining. So my part of the presentation is going to be on building a community health worker network and program to address chronic disease in a rural community. So the objectives for this part of the presentation are going to be to learn the process of building a community health worker program in the rural and underserved areas, gain a clear understanding of the role of community health worker in diabetes and chronic disease management, and then be introduced to options for program payment and funding sustainability. This overview, these are some of the points that we're going to touch on to accomplish those objectives. So we're going to be looking at some of these topics here. There we go. So just a quick overview of the North Country Health Consortium. We're based in Littleton, New Hampshire, and you can see on the map there that upper green North Country part we cover all of that, and some of our services dip into other areas, but that's our main service area. Some of the things that we do, our programs, we always work to meet unmet health needs of our region, and those can include healthcare workforce shortages, gaps in the continuum of care. We work to reduce high ED utilization, and we address social determinants of health, and we also try to reduce those rural health disparities. So what is a community health worker? You may have heard some of these terms in your organization already. Wellness coach, patient navigator, home visitor, or a case manager. Those all kind of fall under the umbrella of a community health worker. Some of these positions require a license or a certificate, others do not. But in the end, they're all doing the same kind of work that falls under the community health worker title. So the actual definition from the American Public Health Association is a community health worker is a frontline public health worker who is a trusted member of and or has an unusually close understanding of the community served. The community health worker is seen as that connection between clients and their medical home and resources that the community may have to offer. They're that link or liaison. Some qualities when you're looking to build a community health worker program, when you're hiring CHWs, these are some of the qualities you want to look for. You want them to be a member of the community in which they're going to be serving. They should be friendly and outgoing, open-minded, respectful, and overall they should sort of be a model for trying to live a healthy lifestyle. It's hard to go in and tell people to live a certain way if we are not following that as well. Here are some of the national standard CHW competencies and complementing roles. On the left are the core competencies. So those are skill sets that you want your community health workers to have. You know, organizational skills, teaching skills, advocacy. And then on the right are your core roles. So those are the tasks that your community health workers will be doing from day to day, whether it be health education, providing referrals or direct services. Those are your daily tasks. So building a CHW program in a rural area, you need to start with funding. The North Country Health Consortium, we attained our funding through both state and federal funds to help build and manage our community health worker program. And then you want to look at different models for what your program is going to look like. The consortium, we've researched across several states many different models for a variety of community health worker programs that serve so many different populations, refugees, children, adults with chronic disease, and there's so many more different models. But we use these ones as a guide to create our own program to serve northern New Hampshire. And at the bottom of the slide here, you can see there's a resource. That's the Rural Health Information Hub. And if you go to that website there, if you're looking to build your own community health worker program or just looking for some general information, that's a great place to start. Information on both funding, models, so much is there for you. So the model that we modeled our program off mostly was the care coordination model. So this was the foundation for our program. And using that model, the care coordination, the community health worker acts as that link between the patient and needed services, physical health, behavioral health care, housing and heating, food-related needs, all those social determinants. And the community health worker role is to assist the patient in meeting those goals, to manage the chronic diseases, and to address those needs around the social determinants of health. And we provide health education and connect them to services that they need. So looking at funding a little bit more, it's one thing to start with a grant, but then that eventually runs out and you need to find a way to sustain that. So some different funding options to sustain your payments would be provider funding based on return on investment and cost-benefit analysis. So that is just showing the providers, your hospitals and healthcare centers, that a community health worker can save them enough money to make it worth paying the salary of a community health worker, and that they'll still be saving money in the end. There's also Medicaid reimbursement, which in order to, some states are moving towards that or have already started that process. To do that, you need to have a certification program for the community health workers, which the state of New Hampshire does not currently have, but we are always looking at that option. And then there's also state funding through public health departments. Massachusetts is an example of a state that has had good luck with that. So some barriers to building a CHW program. Securing sustainable funding, that is always a challenge. Because community health workers have such a broad role and scope, they don't always do the same thing from organization to organization. It can be hard for providers to understand what exactly the role is of a community health worker, and it can also be hard to kind of see the whole value. And implementing a credentialing program, that is tricky. There's a lot to it. If you want to have credentialed CHWs, you have to build, certain education models, and there's a lot to that. So it's more than just a one-step process there. This is our program, the North Country Health Consortium Ways to Wellness Connect CHW program. Our current model is grant-funded, supported by both state and federal funds. And we have partnered with hospitals and health centers and other human service organizations. And our specific focuses right now are women's health and preventative screening, and then chronic disease self-management for adults 65 and over. We just started building this program back in March of last year, and that was, they hired 2 community health workers, myself and one other, and we came in and we wrote our own policies and procedures manual. We started with nothing. And so here we are about a year later. We just started taking on clients mostly, I'd say about September. And we are now up to 40 clients that we're working with. So it's growing quite quickly. We have since hired a 3rd community health worker and are looking to hire a 4th. The education and training once you hire a community health worker. The North Country Health Consortium, we provide community health worker training. We're one of 2 sites in the state of New Hampshire. The second one is housed out of the Southern New Hampshire AHEC. And their course is similar to ours, a little bit different. It's a 12-week hybrid course that we offer. So you meet 6 times in person, and we also have 5 online units in between those in-person sessions. At each in-person session, we offer a different guest speaker based on certain topics. So there might be a chronic disease management, there's an oral health piece, a caring for the caregiver piece. So there's always a really, really great speaker and topic for each in-person session. And then we also built, using Moodle, the online educational platform, we built specific training modules for once community health workers were trained to provide them with some continuing education. And those modules, the ones that we have so far, we have 4. We have one on breast and cervical cancer, we have one on medication adherence, behavioral health, and diabetes. And this class really focuses on bringing that North Country culture to the forefront because it's different than other places. So for your community health worker program, the supervision can be a little tricky. Home-based